I'm Dr. Mark Bodenheimer. I'm an ophthalmologist, and I practice at Baptist Eye Surgeons. I perform a lot of general ophthalmology, where I'll take care of patients' eyes. I will just look at the overall health of their eye. I'll help fix glasses for them if needed, and just give them as good as vision as they're capable of, but also looking at some of the medical parts of the eye and making sure they're healthy. I'm also a cornea specialist, so I do some things that are a little specialized. And that's things like corneal transplants. And so I do a lot of cataract surgery. I do a lot of refractive surgery as well. So cataract surgery, as we age, so you got to think about what cataracts are, and then we can talk a little bit more about what cataract surgery is. So I like to think of the eye, the best way to explain it is to think of a camera. So a camera has a lens, and that focuses an image onto film or onto a digital sensor to make it sharp. Your eye also has a lens, and that focuses what you're looking at onto your retina so you can see it, so it's sharp. And when we're younger, the lens is clear, it works great, we don't have any trouble. Now, some people do need help, even young, by, with glasses to help them see a little bit better. But the lens is clear and it works well. As we age, the lens clouds up. And this clouding is what a cataract is. And it gets to the point eventually, and we all have that. We all experience cataracts. It's just a normal aging change. It gets to the point where you're just not able to see as well as you want to see, and you can't do the things that you want to do. So cataracts, like I said, cause problems with your vision. So you will start experiencing symptoms with difficulty with vision. The most common kind of symptoms that someone with cataracts has are things like glare, especially at night with headlights. That's a very common complaint. People start having more trouble reading. They'll say, hey, I need more light to read. I'm just having difficulty reading, using the computer. Sometimes it's just a generalized things are not clear, and I just can't see faces as well as I wanted to, and those kind of things. So that are the typical symptoms of cataract surgery. And you need to come in and get an examination so we can look at it. And we'll dilate your eye, we'll give an overall look at your eye, we'll determine, do you need glasses or not. And from that, we can determine if the cataract is what's causing your vision problems. What we're going to do when we do cataract surgery is we go in and we take your natural lens out and we put a new lens in its place. Now, the best way I think to explain this is to use the analogy of an M&M. Okay, because the lens of your eye actually looks very similar shape to an M&M. It's larger than an M&M, but it's a similar shape. But it has really two parts that are important to it, and that is the shell, which we call a capsule, contains the center part where this is the chocolate, and that's where the cataract is. So we go up and we actually open the shell up and we take all the chocolate out, and then we put that shell, which is the capsule, is where the new lens goes when we put it back in. So the symptoms of cataract, are caused by the cloudiness and discoloration of your lens. And so when we remove that, the part that's responsible for cataracts is going to be completely resolved. So the great thing about cataract surgery is if you go way back, people will have stories about having had bags placed at their head and they couldn't move and all this kind of stuff. But what's really great about modern day cataract surgery is that you go to a surgery center, you're there for around 2 hours. That's because we've got a lot of things we do. We do start an IV to give you relaxing medicine. We've got to dilate your eye. That takes some time. After the surgery, you're going to sit for about 20 minutes to make sure you're comfortable. But the surgery itself is about 5 to 10 minutes. And most people aren't even aware they had it. So it's very comfortable. So there's no hospital stay. You're in and out. You go home that day. You can actually do normal, easy activities that same day. So the best way to know if you're a good candidate for cataract surgery is to come and visit us and to get an eye examination. If you're having trouble with your vision, then you need to have an eye examination anyway to determine what the problem is. Cataracts are very common. It's the most common surgery in the United States, so it's a common problem people have. In fact, we all have it. We all do it. It's a normal aging change, so eventually we all get cataracts, and at some point they start bothering us. So if you're having vision changes, you need to get an exam, and at that point, we can determine if the cataracts are the problem.